is January 6th. We're going to go ahead and call this commission meeting to order. This is a working meeting today. If you please all stand and join us for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Before we start with the phone call, Franklin, is your microphone turned on? All right. We have the email that was sent to us and brought to us by Dina on Monday on the vehicle. Are you okay with him putting the one that he requested to put on hold? On hold, he needs an affirmative from us?
The best he's got so far, I would say. When we talk shift, I don't want to get a better definite price maybe, but at this point, I think that's the.
So will you give him an affirmative on that, and then he goes ahead and puts it on hold? He can't do that without us giving him the go.
Okay, and or else I can get one to her that he get a little more firm price. I think it'll come down some.
He can't move on this at all, ask him to hold it or anything without
We
a
can
go ahead?
hold it, that part would be okay for.
So that's an
10 days.
affirmative go ahead?
Yeah.
Okay, I will grant the same, so the record show that you've given Dana permission to put that truck on hold, that he indicated as his first choice in Monday's meeting. Laura Obert, Broadwater County. Hello? Yes, hello, Laura. Please call me Laura. Good, thank you. How are you? Good. Thank you very much. Same to you. I'm going to put you on speaker, and we have at this point Commissioner Slivka and Ann Rouser, who takes our minutes, and then a crowd full of folks from the public. All right. Do I still have you?
Yeah.
All right, wonderful.
Great. Would you maybe to start, do you want me to just introduce the folks we have here?
Perfect. Yes.
Okay. Okay, then maybe I'll start, but we wanted to throw it open to you guys on how you'd like the conference call to go. So I have myself, this is Todd Harwell, I'm the Administrator for Public Health and Safety Division. I have Jim Murphy, who's the Bureau Chief for Communicable Disease Control. Terry Ray is here. He oversees our Office for Public Health System Improvement. Denise Higgins is here. She's our Bureau Chief for our Family Community Health Bureau, which is pretty much all of our maternal and child health programs. And then Kate Gerard, she's the Director of our Women and Children's Program.
Thank you.
No problem.
Um,
Maybe if it's okay with you and Commissioner Slivka, I'll just throw out an idea for an agenda.
Okay.
If that's okay.
You bet.
We were thinking if you guys wanted to start maybe just to talk about your ideas for your transition plan, if you made any decisions and any thoughts about like recruitment for staffing, then maybe we can go into and walk through. Right, currently we have our task orders with Broadwater County for system improvement work, for emergency preparedness, for immunizations, for
great.
Fine with me.
Do you guys want to start first, or would you like us to talk about programmatic areas?
We can give you a quick update so that we're all on the same page as far as where we're at today, if you like.
That'd be great.
Okay, and we do have need for this room at 1 o'clock. Do you guys see a need for us to be longer than 2 hours?
We were kind of assuming we're just going to be 1 hour, but.
Okay, that's what I was assuming as well. So where we're at is we have A to Z Staffing Solutions is sending us an RN, and they're going to send the transcript directly to Kate to review for WIC. But we do have still the contract with Missoula for the dietitian services for WIC. So hopefully between the two, we can get WIC going this week again. And that, we do have, and that's about where we're at this point. So, yeah, if we could go through the different grants and you could let us know of any upcoming deadlines we need to be aware of, or like you said, advice in staffing, that would be great. Whatever you can share with us from your level of expertise is greatly appreciated.
Okay, perfect. And so, and you know, too, I guess, again, we were kind of just anticipating that the call would be an hour, but if we need to if you guys need additional time with us, we'll figure out additional time to, we'll do whatever we need to make sure you've got the information to help you move forward.
Thank you.
So maybe I'll ask Jim to start first with communicable disease-related activities.
Sure, I'll go ahead and start, and if you have any questions, please let me know as I go through this. In our bureau, we've got essentially 2 contracts, and then we have some statutory requirements. So just talking about the contracts first, the immunization contract, it's a relatively small amount of money. We have sent a contract down to the county. That contract starts on the calendar year, January 1st. We haven't received that back yet, so if you have any questions about that, or if you need us to resend anything, please just let me know. That's completely an optional thing. However, all the counties do have that contract, and it basically just bolsters immunization services, and it requires you to work with partners. We have plenty of time to kind of get caught up on that because we're just beginning that period, so I'm not too worried about that one.
Okay.
The other major contract, which is a little bit bigger one, that is about $26,000, is the Public Health Emergency Preparedness Contract. We are about halfway through that contract now. That contract started in July. So there is work to be turned in mid-January on that contract. If that work isn't able to be completed, you could contact the program as described in the contract and ask for an extension. That routinely happens during transition, so that's not really a big deal. That gives you some extra time to get caught up, but it does withhold that quarterly payment until the deliverables for that contract can be turned in. So I think that contract deliverable is due January 15th, so that's coming right up. Probably not in good shape on it right now, to be honest. So I think if you contact us with an extension, or if you want to ask me on this call for an extension, we can take care of that. And then when you get that staffed, we can sure visit with whoever is going to take that over and get things back on track. Again, all the counties and tribal governments do have that contract, so it is an important one to help with emergency response. The last thing I'll talk about is different from contracts, but it's pretty much the legal responsibilities that all the jurisdictions have under state law and under the administrative rules of Montana to respond to reports of communicable disease. Reports that are given directly to the county health department, or in some cases are passed to the state health department and then we pass on to you, are supposed to be investigated in a timely manner. I know you still have Dr. Campbell as your health officer, who may be able to help with those as well. So what I would be looking for there is you provide us with, who you want us to talk to regarding communicable disease events, so that we know who we're supposed to coach on those, who we're to pass reports on that might come directly to us. That person would also
Franklin, you have any questions?
No questions right now.
Jim, I do. One is, can we go ahead and request that extension on the FEPS grant?
Yep, I'll go ahead and we'll get a note out to you then saying that an extension is granted on the FEP contract. And just extend that offer that when you do get a person that you think will be able to take that part of it over, we would be happy to meet with that person, get them back on track, and kind of leave this just open-ended right now. It's only the second quarter, so you've got plenty of time to kind of catch up.
Okay. And the immunization grant, I have a copy of that. I'll go ahead and get that on the agenda, and then we'll get that back to you
Okay.
here immediately. And then for the communicable diseases, can you keep Dr. Campbell as your contact on that for reporting to you?
Yep, that would work fine. We'll just let all of our folks know that, we'll work everything through the health officer right now as our primary contact.
Okay.
Very good, that's what I had down here for suggestions.
Okay, thank you. We'll reach out to him and just tell him that that's the arrangement. Make sure he has our contact information as well in case he needs to get a hold of us after hours.
Wonderful, thank you.
Okay.
And this is Todd. I'll just jump in on the other area, and Terry, you help out if I'm missing things. So we also have a small contract with the county for public health system improvement activities. So you're probably aware about what the work that is being done. So it's basically we're funding a lot of counties, particularly the smaller counties, to work with their local hospitals and conduct community health assessments to basically identify what the health priority areas that the health departments and the hospitals should be focusing on to improve in their jurisdictions. And so Clara and Missy have been doing a really nice job. They had pulled together, I believe, a number of stakeholders across the county, and they were working with our staff up here in our office to start doing some of the development of that community health assessment. So that funding goes through next February, through next 2017, and I think we'll have some flexibility with that. So we can, I guess, our advice to you would be is if you want to continue that, which we hope you would, because I think it's a good exercise, we can hold until you get your new staff hired, and then work with them to kind of get them up to speed on what were the deliverables for that activity. Actually, it'll be a very good project for brand new staff to work on because it'll help orient them to what the health needs are for your guys' community there. So if that sounds okay, we'll do the same thing with Jim, like Jim was saying, we'll send some communication out to you just to say, we'll try to figure out a transition plan once you get new staff hired, and then hopefully get those activities continued and finished.
Perfect, thank you. They've been working on that a lot. I've been in a lot of meetings where that's been discussed, so that's an important one. Thank you.
Okay, good. Maybe, and now I'll just ask, maybe Denise, you want to talk about block grant fundraising and FICMR, and then we'll go quick.
Good morning, Commissioners. This is Denise Higgins. I'm the Bureau Chief for Family and Community Health Bureau that oversees maternal and child health activities for the state of Montana. Within my bureau, we have two contracts with Broadwater County. One is our WIC contract, and I'll have Kate discuss that. The second one is a small contract for maternal child health and fetal, infant, child, and maternal mortality reviews. This contract is $5,200. Contract date runs July 1st through June 30th, 2016. There are a couple deliverables coming similar to what Jim Murphy had mentioned. On January 15th, the second quarter block grant report is due. There's a PDF template. Misty Sangre was our contact for that project. We do allow for an extension on that due date. If you could just provide me with the contact who that would be, then we can make some connections as similar to what Jim had mentioned. The other components of the maternal child health block grant is fetal, infant, child, maternal mortality review. This is a statutory requirement from FICMR, in where the Broadwater County has a MOU with Lewis and Clark County for review of infant, child, and maternal deaths. Those deaths that occur in calendar year 2015 must be reviewed by December 31st, 2016. So you have some flexibility with the due date or the deliverables associated with FICMA review. Were deaths that occurred in Choteau County that the Choteau, is that Choteau County? The deaths occurred in Choteau of Broadwater residents, and Choteau would like some assistance from Broadwater County to help complete those reviews. They just asked that I relay that message on. That is pretty much it for the maternal and child health block grant. Do you have any questions?
Can you speak a little bit more about what Choteau is looking for as far as help? Is this monetary help, or do they want to work with our staff as soon as we get that up and going?
There is a report form that needs to be completed, and they are just asking for assistance to complete that report.
Okay.
And I do have contact information that I can provide you in an email following this meeting.
Oh, that'd be excellent. Thank you.
Yeah, and this is Todd, and just to add a little bit to what Denise was saying, so the goal for the goal for the FICMA program is really to look at preventable deaths in all the jurisdictions across the state and identify what child and maternal deaths could have been prevented and identify strategies to help address those to prevent them in the future. So all the counties collaborate and work on those and submit data to the state so we can roll it up and look at where do we need to kind of focus our time and resource to prevent infant and child and adolescent deaths. So it's actually very important work. But it sounds like from what Denise was saying, we've got plenty of time to get folks trained in that program and start working on the for next year. So, okay. And then maybe I'll turn it over to Kate and Denise. Maybe we can
Put
talk
that
about
microphone
the
closer,
staffing
Laura.
requirements for WIC and some ideas about potential next steps.
Thank you.
Hi, this is Kate Gerard. I'm the WIC director up here at the state. And the WIC program runs on a federal fiscal year, so our contract with you all is through September of this year. And, you know, the WIC program is a much more complex program to summarize briefly, but I will just address the staffing requirements and some really high-level important program requirements to consider. As far as staffing, and Laura and I talked about a little bit about this previously, and it sounds like you have an understanding of what we call a CPA is. That's a Competent Professional Authority. It's a term only used by USDA for WIC, and it's essentially a person who's qualified to perform health assessments within the scope of WIC, and they define that as a dietitian, a nurse, a doctor, a physician's assistant, a nurse practitioner, you know, that level health professional. They also allow for other health professionals defined by the state to qualify to work in the program, and each state has their own criteria. So I won't go into great detail about all those other options, but it sounds like if you have a nurse that's willing to work in the program, we can look at their credentials. We do require that they have some nutrition background, which tends to be a little bit more than the average nurse has. The average nurse does have basic nutrition and anatomy and physiology, but we also require an additional nutrition class to qualify. If they do not meet that criteria, we have an allowance for a temporary plan to be put in place while you're working on a permanent solution. So if we review those transcripts and they don't quite meet our criteria, what I would request of the commissioners is to write to me and ask for a temporary exemption that she can work in the clinic and provide a plan of a more permanent solution. Typically, if it's a permanent employee, the plan includes putting them through school to complete those classes. With a temp employee, I'm not sure if that would be an appropriate plan, but if you're posting the position for a more permanent hire or you have another more permanent solution, then we can look at that. In the meantime, though, a couple other things to consider is that our contract does covers Mar and Jefferson counties. And so Misty and Clara did do outlying clinics. They would travel down to those clinics once every 3 months. There's a total of 4 clinics, one out in White Sulphur Springs, one in Boulder, and one in Whitehall, as well as the Townsend Clinic. And so I would ask that whomever takes over the position is willing to provide services to those clinics. Another requirement to consider is that new pregnant women must be offered an appointment within 10 business days, and then all other WIC participants must be offered an appointment within 20 business days. And if you need an exception to that rule, you would need to write to me for each applicant. It's not an overall waiver, but if you had someone who called and you couldn't serve them, you would have to contact us and ask us for a waiver. We have been fielding some of the calls from your local area, and we've been deferring those folks to the next closest clinic. So right now, the WIC participants are having to travel at a minimum of an hour to get to the next clinic. So it depends. So White Sulphur Springs, we've been referring them either to Great Falls or Bozeman. Boulder or Whitehall would probably go to Butte or Helena, and then Townsend would probably go to Helena. Yeah. So, and those clinics we have been in contact with, and we've let them know that they might have some folks calling that we would like them to squeeze in as, at their convenience, at the participant's convenience. As far as the new person that you have come on, I would highlight that the training to do WIC services is extensive, and so I think getting an applicant discussed this week is viable. Actually, running clinic, I would really plan on several weeks. They will need to train. They will have to get access to the system, train on our system, do civil rights training, and a lot of additional training to be able to run the clinic independently. Working by themselves, there's going to be a large learning curve, and I am happy to provide technical assistance and point you in the right direction on how to provide that training, but I would consider that it'll take some time for that person to really learn WIC. Any questions about that?
No, not for me. Franklin, do you have any questions?
Not on that part.
All right. We have a gentleman in the audience who has a question. Yes.
Craig Burns, are those WIC requirements required of that full-time employee? Because all the requirements that you just asked sound like a full-time job.
I'm sorry, I didn't hear the first part of that question.
He asked if they are, it sounds to him like a full-time job. Can you address that for WIC specifically?
So, not really. I mean, WIC could be a full-time job. I mean, it really depends on how many participants you're serving. So a WIC ratio that we tend to recommend is about 1 FTE per 300 participants. And right now your caseload is running about 140. So I would count on about a 1.5 FTE. So 2.5 to 3 days a week is what I would count. 3 days, really, because you'll have someone new and it's going to take them longer to work through the process. If you had a very highly efficient WIC employee, they might be able to squeeze everyone in 2.5 days a week. But at least 3 days a week, you would want to commit someone to the program.
Any other questions for Kate from commissioners or other folks?
I have one for Kate. I hear what you said about the training and all the ancillary training that goes into it. So what you're saying is what we should be doing right now until we get somebody on board, and we may have someone at the end of the month who is very close to WIC certified, and you and I talked about that. Until that time, we should just go ahead and refer people to Helena or Bozeman because of all the ancillary requirements. And I'm thinking of non-ancillary as being our contract with the dietitian in Missoula and the fact that we may have a nurse in. It still won't be quite enough. Is that right?
I think if the plan is that the person we spoke of is ultimately your more permanent solution to write off the contract, and that she's willing to pick up and do WIC again as early as the end of this month or beginning of February, it may not be worth the investment of time, money, and energy to have someone training the next several weeks to just provide a few days of services. I would anticipate, best case scenario, if you sent me today or tomorrow some transcripts and someone fantastic was willing to start on Monday, they wouldn't really, ultimately what we'd have to do is we would physically have to come out there and train them hands-on, and we would have to commit our staff time for at least a week or two sitting side by side with that person. I don't see any other way for that person to be trained, really. So to do that and then to have them leave and this other person sit in that seat and pick up the job doesn't seem to make a lot of sense.
Okay, that makes sense. Thank you. We have one more question from the audience for you,
Then who would pay for this training?
and that's Carol Plymel. We would. That would be up to the county. I
Well,
imagine. Wouldn't-
you know, the state office provides assistance. We wouldn't charge the county for that. It would be an obligation of our staff time, so I would have to consider what we have going on. But, we wouldn't be like billing the county for the training. Most of the training is online and is accessible without any money involved.
That's
If
unique.
you're
Thank you.
referring to the classes that would need to be done, there is money built into the budget for that, but so your local agency budget could support that. But we do have some funding at the state that if you had a permanent employee that needed a class or two, we could potentially help fund that.
And so I'll clarify, just so make sure you guys understand. So that if you say you end up hiring a nurse who has limited or no nutritional background or training, you can use money out of the contract, or we can look at other sources here to help cover to get that person up to speed in terms of education.
Okay, thank you very much. You just reiterated the fact that they would be willing to work with us, and there is training available at the state level for us.
Laura,
So-
this is Denise. I'd just like to add that there is a maternal and child health block grant and STICMR training that will be offered to all counties at the end of March. So should you find a more permanent solution, there will be some training related to that contract and those deliverables at the end of March.
Thank you very much for that.
And this is Todd, I'll add in, because I think the goal here is to, once you guys, you have your staff hired and you've got your plans moving forward, we will figure out ways to ensure that your new staff are totally trained and up to speed. So one example is in your previous lead local public health officials, that's what we call them, who was Linda Campbell. We have a day-long orientation here in Helena for new lead local public health officials, so we can definitely get your new person involved in that. And then we also, if needed, we'll either have our staff from our programs here come down to Townsend, or if you want to have your new staff come up to Helena, and we can get them up to speed on all of these contracts and grants.
Thank you very much.
I guess I got a question on the staffing. Now, are you going to find people that could come down here? Or is that strictly up to us to find the staffing?
That would be, the county would do the hiring and the processing for your local staff.
Right, but would you be sending any applicants to us?
That's not normally how it would normally happen. Like a county government would just use their normal day-to-day process they would use for recruiting and hiring new employees, whether it's for transportation, health, or other areas.
Okay, thank you.
And just to clarify, maybe that question stemmed from what Laura and I were alluding to, which is that the WIC office has to approve CPAs specifically to work in WIC, and so that we take a look at their transcripts and make sure they meet our criteria. So we do need to screen a CPA working in WIC, but we wouldn't be responsible necessarily to hire or to say this is who you should hire. Right.
Yeah, and let me clarify. They were talking to the other thing, just so you guys know, that
makes sense. Did I see another hand up? Craig?
So on top of the full-time role as a full-time nurse here, they would also be expected to do all this cross-training, and they're also a brand-new employee? That doesn't seem possible.
Did you hear the question?
Yeah, I don't know, was that a question? No, that gentleman, I think we agree it will be challenging because, basically it's, the county's starting from scratch and there are, a lot of programmatic areas, to cover here. I would just say the feedback I've gotten from my staff here is, Ms. Sinclair, we're doing an outstanding job, but I think there are going to be some challenges. But we will do whatever we need to do up here in Helena to help support to get the folks trained and up and running. And I think too, you may have heard, I think from our end, the big issues that we want to initially make sure that are covered are communicable disease issues. So if there's an outbreak of pertussis or something, we're working with Dr. Campbell and any other folks down there to address that. And then I think the next immediate priority is to try to get WIC services up and running, and then we'll work to get the remainder of those activities rolling over this year. But yeah, I agree, it's a lot of work.
Yeah.
One more question.
Yes, Craig?
Yes, can those duties of the WIC officer be split between different employees? If there is having a turnover problem here, and if that person that was cross-trained was to turn over, that person would be lost again, and all that training requirements would go back onto yet another person to be cross-trained again. Is that possible to train more than one person?
In fact, it's nearly federally required that two people do split the WIC duties, but in small agencies, that's not always possible. So WIC does have a regulation that states that separation of duties for integrity purposes to make sure that, one person isn't, mishandling the program. Having two people is really the ideal situation. Given the caseload and that it's really only a 3-day position for one person, we're willing to work with the county like we do with other small counties, and we have other means to make sure that it's running okay with one person. But you're absolutely right. If one of my concerns with having a temp position is if that person was only there a few weeks and you have someone else, it's not the type of program that it is easy for various different people to jump in and work in. But I agree, if there are two people, if it's possible to have two people working in the public health office, it would be ideal to have both of them trained.
And for any department, it's always ideal to have that cross-training too, because you just never know what can happen. So that's good information to have. So is there anything you guys can think of that we haven't asked that we should?
Well, I guess one question is more, I think, from our end is, when Jim Murphy and I went down a couple weeks before Christmas to meet with you guys and talk to you, you were talking about different ideas and different models you were looking at, and we were just curious if you made any decisions about, if you're going to keep the public health services located within the county. You had talked about potentially looking at the hospital, and this was before all the staff turnover. So we were just wondering if there's any decisions been made on that, or if there isn't.
We haven't come to any decisions on that, just because this kind of hit us and overshadowed any other thoughts of how to increase services or any of the other questions that came up as far as reducing costs. But I think one of the things that has come out that is pretty solid with everyone is that we want to keep the services separate of the hospital building. So regardless of who the administration is or the supervision is, we want to have the public health building providing the services that they have been, the WIC services, housing the public health staff. We wouldn't want to move that into like the clinic or the hospital building, and that just comes from some of the advice we've gotten from some of the other counties. So having a separate location is a priority with us at this point, just based on feedback. Any other opinion on that, Franklin?
No, I'm finally glad to hear that. The way it's been, it was gonna be a big change in turnover and everything, but, basically, that's what everybody feels, is to keep it like it was, if we can get it staffed again and going.
The location, yes.
Well, definitely the location. Yeah.
That was, that was actually not one of those things that was a focus of changing, and was kind of solidified in investigating and looking at other counties' models. So it's a good thing sometimes to ask the questions, even if it solidifies that the location is the best one. So that's where we're at this point. We still don't know some of the particulars, but some of the particulars I think we've pretty much solidified. If that answers your question.
Okay, no, that does.
So,
And I guess, I don't think we have anything else, so I think we could, well, Kate has one other thing,
All
sorry.
right, I do have one question. So Laura, the person we spoke of who's a potential candidate to come back to WIC here in a few weeks, I know that she is a dietitian, and that would be a very easy transition. I think I'm very optimistic about that potential, because I think she would just click right back in and be able to pick up where she left off. So I'm very confident in that idea. I would highlight for y'all to think about, though, is that she's a dietitian and she's not a nurse. And so if that's a consideration, that you're looking for someone to be able to provide all of the different services, really she would probably just be focusing on WIC. So that's just something I wanted to highlight and see if that was something you'd considered.
yeah, and I think Craig spoke to that too. This is too big a job for one person. It looks like most of the other public health offices of our size are at least 2.5 people. So I think we would probably be looking at having to have an RN separate of, this particular WIC professional. So yeah, I just don't think one person could do the whole thing and do it justice.
Sounds good. Then I think we're on the same page.
Okay, good.
This is Todd again, and I think if we didn't have anything else here to add, I guess the only things I would maybe just quickly summarize a few things. So you clarified that for disease reporting, we'll work with Dr. Campbell, the health officer, will continue to do that. Jim's going to send you, or we'll send you some information about the contract extension for preparedness grant. And then I think the next steps are, once you have identified the WIC person or persons, if you could just send their resume to Kate here, and then we could give the review and approval of that. You have to do a transcript if you need a resume and transcripts. Just transcripts, okay. And then once you all hire the other staff, just let us know, and we can either set up times where they can come up to Helena, and we can get all of our staff here to help get them oriented and trained, or we can have our programmatic staff come down to town for them to do a day or two.
And this is Jim, just one question for clarification too. Laura, are you the Board of Health chairperson as well?
Yes.
Okay, any notes that we send to Dr. Campbell will copy to you as well then?
Fantastic. Very good.
Or this
I'd like to get those too.
the contact for the maternal and child health block grant.
For the time being, I'd be happy to.
Okay, and then we can grant, would a 3 to 6 month extension be appropriate for the deliverables associated with that contract?
Yes, that would be perfect.
Okay.
Back to that information that we sent, this is Franklin, I'd like to receive that too.
Sure.
Okay.
And any of this other, these grants here today, I was trying to take notes here, but I can't keep up, but I appreciate all that too, please.
I think that's all we can think of up here. And, we're just, we'll look forward to once you guys hire your new staff, working with them and helping get things up and running again.
That sounds great. You guys are really tremendous in the help that you are providing and have provided. We
Madam
greatly
Chair.
appreciate it. We have a couple of questions from the audience. Carol, was that your hand?
Yes, so when you hire the staff, who will be the supervisor?
we would have to look into that. We don't have anybody hired, not a supervisor or staff yet, so, that's gonna be part of the process, and it's all defined in employment law.
And I just have a comment that everything seemed to be rolling along fine. Positions were filled, grants were filled out, reports are probably filled out, and all of a sudden this nice little apple cart is upset, and so am I.
All right.
Just want the state to know that.
Laura, did you have your hand up too? No. Okay. All right, it looks like that's all the hands up here. So, oh.
I'd just like to thank you folks for helping out on this. This is a very unfortunate situation that we're stuck in, and it's just one heck of a mess, and we sure appreciate any help that you're working with us on it. And thank you for that.
No problem. We're glad to help, and we'll look forward to working with you and helping get this turned around.
All right, any
So,
other?
If that's any other questions for us, if not, we'll leave you to your next agenda items.
Well, thank you again very much. We really appreciate the help.
Okay. You guys have a good day.
Thank you, you too. Bye-bye. All right. Yes, Melinda.
Madam Chair, yes, I have a question as far as that. This is the first time I ever heard about it being separate buildings, even if the hospital has control over it. Well, my question is, yes, the hospital has control over it, it has a separate building, but if the hospital goes down, does that not still go down too because it's hospital control?
No.
How
No.
do you prevent that? I mean, I don't know, I'm questioning, I don't understand how.
Public
that would
health
not-
is a legal requirement that the county offer it. So we would be obligated to pay for it regardless. The only thing is where can we get the biggest bang for the buck? Can we get the biggest bang for our buck by the county supervising and hiring supervisors, or can we actually put that money into services instead? That's what we were looking at. Yeah, it's erroneous that we would be changing the building. That's one of the rumors that's out there, and it's not true.
That's the first time I heard that right here.
Yeah. So, yeah, at this point, that's just one of the questions. Where do we want to put our money, into staff or into services?
Thank you.
Craig?
It sounds like, from what he's saying, and I'm sure if anybody even caught wind of that, that sounds pretty overwhelming to whoever those duties were about to come to. And it kind of sounds like that's what kind of caused the upset, is that we got a lot of requirements coming down from the state and federal government and kind of trickling down to the county, and then the county's trying to deal with it, but at the same time, we're trying to deal with just basic health care, and you got a nurse that's pretty much the pivot point of that entire process. And while it's easy to talk in a group of people about these processes, it's another thing to actually do all the things they listed. That's quite the list. I mean, even two people on if they were concurrent. So that I don't know, I don't know what happened in the past here, but even if you had two people that were concurrently doing their job and they were to take on those tasks that they list, that would be pretty overwhelming. Much less now. No people, and then they're going to have to learn their job at the hospital as well as the county and take on WIC. So I'm curious about the whole merger of the hospital having anything to do with the county. Just sheer fact that the nurses involved would be overwhelmed by having to do both health problems and administrative problems at the same time. Is there enough staff to handle? To spread all that out evenly so we don't stress everybody out?
That's what we need to do, is make sure we have the staff to do all of the different pieces that need to be done.
Right.
But there wouldn't be any, what we learned from looking into best practices around the state is you don't have nurses from the hospital coming into public health and switching back and
Right.
forth. That's really done in one county, and it's the supervisor role. What you do have is your public health staff, your public health building. Those people just are public health employees.
Right.
Yeah.
Right. So having nothing to do with the actual physical part of the hospital duties, more of the just kind of leak over administrative stuff that comes over, as in reporting, reporting data or recording data and then reporting it back up to the county.
That
So
could be,
a
yes.
nurse, so a nurse is not really a nurse at that point. She's just a qualified nurse and wouldn't be doing nursing, or he or she wouldn't be doing nursing
You're
duties.
still doing nursing duties because they're giving shots and doing.
Okay, so that's what I'm asking.
And
right
so, working at the county health department, all of the different things that it sounds astronomical on there, and when it's not really that bad if the person is qualified and capable of doing the position, you know, so I mean, but to get someone that's never done it before, yeah, then they're gonna have weeks and weeks and weeks of time of training. They have to get their nutrition stuff, they have to get WIC certified, they have to get all of those things. If they've never done it before, it's gonna be overwhelming for them. But the girls that were in there were qualified when they got hired and did the job, and they were doing that. But the county health department still provides shots, and they take blood pressures, and they do.
They do, so right, so it is a physical office, it's not just administrative office.
Well, and that's why they
That's
said
exactly
that
right, it's their own
the
separate
one gal that
office.
they're gonna hire is only, that they're looking to hire is only a dietitian.
Right.
She's not an RN, therefore
So
she
she can
can't do the
consult,
job.
she can only consult and process
Well, she
paperwork.
does the dietitian stuff. She can't give shots, and she can't do all the blood pressure things and all the other medical portions of it, because she's not an RN.
I think
That's
you
why we
should,
talked about multiple people.
Right.
I think
Right.
that
Can't
it should
all
be
fall on
looking
one
at,
person's shoulders.
she can't be a nurse.
So,
And that was previously done by a contract out of Missoula, so it wasn't full-time, so she's just kind of, whoever's coming out was just kind of doing what she can to help, and then disappears, and is no longer part of the community, so to speak. So if we did have an actual community member that was doing it, then it would kind of,
Well, the
Kinda
dietitian
concurrently
has a
help that.
small role. You know, it's just someone for them to run some things through.
and it's what Kate had said on the phone. This isn't a one-person show. You really do need at least a staff of 2.5, 2 FTEs and 1 PTE, to be able to get everything done.
right, just on the WIC, just
Right.
on the WIC and the federal, much less the
Right.
county, less all the county duties.
Well, the WIC is part-time, like she said, probably 2.5 to 3 days a week, based on the number of clients. But that's a dietitian. But yes, to give the shots, you have to have a nurse. There's your 1 PTE, your 1 FTE, your full-time, your secondary part-time or full-time, and then you need to have somebody with those grants, like you said, the requirements from the state. You don't necessarily have to have an RN reporting on the grants. That can be clerical and is in a lot of counties. There you've got another cost savings. So there's a lot of different things we can do to get all the jobs done, but it's not just on one person's shoulder.
See, what's really followed this up, Linda Campbell took care of this office for 20 years, and she was gonna retire. I don't know if you know any of this or not, but I'm just gonna give you a little brief, quick history on this. And so, she had these 2 gals, and she come to us that she's gonna be retiring, and they're fully qualified, and they were. The 2 of them, they could handle everything. They had great plans, everything was really going good, up until about, well, some of this little in-between stuff started, I guess, several months ago, but in the last month, everything just went plumb sour, and a mess we should have never been in. Go ahead, Harold.
I can't see where you're gonna have any cost savings if you're gonna do the administrative work from the hospital and you're still gonna have 2.5 people. I don't see where the cost savings comes in at all.
Well, if the county pays for a supervisor at, say, 70 grand a year, wrap rate, that includes all the benefits, the FICA, the Social Security, all that good stuff. County pays it or the hospital pays it. So if the county pays it.
How's the hospital can't even pay their own bills.
Actually, Harold, that's not true. You're speaking out of turn on
Where
that.
we get them
But that's where you gotta look at it is, if you look at just the supervisory, the supervision role being from the hospital versus the county, as you were asking, there's a savings right there of 70 grand, easy.
I haven't seen my town, all I see is the hospital asking for more and more money. Is that not
This
correct?
isn't about the hospital, this
Well,
is
Kind
about
of,
it
it
certainly
actually
is
is
about
about
the
the hospital, because the
It
hospital's been mentioned many times here, so I mean, you can't just say it's not about the hospital.
Well, I can't.
The hospital's involved,
I can't
so.
because it may be, it's not now. We don't have a plan yet. All we did was go out and ask some questions. That's it. That's our job. That's what managers do. That's what we're supposed to do.
Well, we're just asking
So we
questions
did.
about that.
I know, and I'm trying to give you the answer. One of the things that other counties are doing is they're having the supervision, the administration, performed by the hospital. Carbon County has the hospital administrator already being paid acting as the supervisor of public health.
Gotcha.
How many other
So
counties?
you're
are
not
doing
paying
that?
a dime more for that administrator to take on the supervision of public health. But the employees of public health still do the
Well-
public health, still have their own building, so there'd be no
Not
change.
directly though, it actually,
Yep,
no,
yep.
not directly, because what you're
Mhm.
saying is that the county would then not have to pay that 70,000, so to speak, for the person. But then on the back side of the whole tax bracket, you then have to re-stimulate the hospital, and then the hospital with the new money then takes up that supervisor role. So in the end, the taxpayers still pay for it because they have to bolster the hospital, right?
No, because again, the administrator's already being paid.
But isn't the
So it's
hospital
not-
had past financial problems that haven't been balanced?
But it-
Or are they
no.
balanced?
The hospital's doing much better, I'm not gonna speak on that because I'm not an expert on that, but Jenny has been here many times to share with hospitals.
Well, you're the
after
chair,
her-
you're the chair of the health board, so, I mean, it's,
Board of Health, but
Board of
that's not
Health.
the hospital.
okay.
The two are totally separate. But if you already have somebody on
But
the
they're not in
payroll,
the case that you're talking about.
let me finish so that you understand. If you've already got somebody being paid, it's not gonna be any additional there. So, yeah, you can talk about bolstering the hospital, but that's separate. You've already
Okay,
got a
so
finite amount
I
of
mean,
money.
I'm just
and
clearing
that
this
person's
up.
not just
So
taking on another
you're
role.
saying that if the hospital takes this role, that there will not be an increase in taxes to help the hospital take this role?
No, not unless the
Okay.
citizens say, yes, we wanna pay
Well,
the
I
taxes.
think that's
It has
important
to
to
go
put
to
on the
taxes.
table, because I think it's thought that the hospital is going to be re-stimulated through the backside in order to take care of the things of the duties it keeps taking on. So all this is free and free and free, and then nobody has to pay for it, but then underneath, that hospital then at the end of the fiscal or the end of the year says, hey, we need more money to make the hospital run. And that right there is that same money that would have paid for that supervisor role, because if the hospital had just not taken on those roles, it wouldn't be stressed and it wouldn't have to then take money at the end of the year to rebalance itself. I think that's really the concern, is that the hospital hasn't balanced, and if the hospital can't balance itself, then how can an unbalanced hospital handle the county level duties? That's a
Well,
fair
now,
question.
keep in mind, the county is obligated to provide public health. So we may not be paying that 70,000 for the supervisor, the county is still obligated to pay. So there would be still county money going into public health regardless of the model, it's just, is it this amount or this amount? So the county still pays.
Well, I
don't know
think,
if that
I just
helps.
think if
But-
that was outlined, and it was outlined to the community and outlined to everybody, exactly where this money is specifically, thought to go, then there wouldn't be an elephant in the room as far as where the funding is coming from and where it's going to go ultimately. It's kind of like nickeling and diming instead of having a budget, is kind of what it feels like with the hospital. And I think if there was a clear, concise budget put together by the hospital and even the county to say this is exactly the benefits and the not benefits of doing this, then it might give public support for it a little bit more, because they didn't have an understanding of where these funds are exactly coming from. Because fair enough, the hospital does not have a good record. And if it did have a good record, I think this would be a complete different conversation, but it doesn't. And so therefore it's, the county has already bailed the hospital out before, multiple times. So here it is, once again, but all new people, and the hospital puts itself in the exact same position that it did 5-10 years ago, and here comes the county and the taxpayers have to re-bail it back out again. So I think people who have been here a long time, have already seen this process go through a couple times at least, and are weary to kind of see just do it again. And basically, while everybody's saying, hey, this might happen again, and there hasn't been an actual evaluation done. And so I really would request that the board thoroughly do a budget analysis of this and release that budget analysis as to the cost projections of what this is going to overall cost the hospital, the county, and how it's all going to be ultimately balanced. I think if that was clear and on the table, there wouldn't be really any arguments about how it was going to work. Everybody knows that it's government and it has to balance here and do this and that, but transparent government means everybody can kind of see that and see what's going on. As soon as it's not transparent anymore, we don't really know what's going on, so everybody just drags their feet saying, hey, we want to see. So
The hospital's been asked for a budget, they never have provided one.
And that's what I'm saying. So if the hospital is more transparent, if the hospital is going to be involved in county duties and county business, then the hospital has to be just like the county, transparent. It's just how it has to be. Otherwise the hospital can't be part of county, because it is a requirement that government be transparent, and the hospital's not transparent. So hooking itself to the county and then not being transparent, it looks sneaky. It just does. I mean, even if it's not, and even if you say it's not, it still just looks sneaky. So I think if you want public support of this entire transaction, then we just need to have transparency of where the budget allocations are gonna go.
I hear that, I thank you for that. Let me just back up one step or two. We're not even there yet. All we did was ask questions and go on a field trip, and everything just exploded from that. I don't know why, it is baffling
It
to me.
exploded from that secret
but-
meeting you had with the nurses, and that's what,
There was no secret meeting, Franklin, that's ridiculous. But
There
as
was,
far as
definitely, I'll
if
tell you
there
that.
is a proposal, if there is a plan, absolutely, we will put something together. What happened is we asked questions, we did an investigation, we went on a field trip that the nurses were invited to, and they sent Julie Lethard in their place. And then we came back and everything fell apart, so nothing has happened since then. This is just rumor run amok
I
again.
totally understand that, but
we
what I'm
will
saying
be
is that
putting-
this has happened.
If anything is
This
done
has happened
today,
before.
things will be put together so that people have that.
It's happened before at least
I
twice.
know, I understand that, but we have to look at, how are we gonna move forward? Do we always move forward looking behind, or do we move forward with new plans in place, new board in place, new administration in place? You know, that's the reality of what's going on.
Same hospital in place.
It is the same hospital building, you're
Right,
right.
that's what I'm saying,
But-
everyone's concerned and why there was a knee jerk. I'm
Sure.
trying to just let you know, the knee jerk
understand
was,
that.
you inquiring about all these things just brought up old feelings of past situations that have happened that the community had to bail out. And now people have changed, everything has changed, and the same situation has come forward again. And it's like stepping on the ice after someone just fell through. And just because, you know, it looks like it's solid, someone just fell through. So you still have to kind of approach it different. So the blazing forward is what everybody kind of knee-jerked for. It wasn't just because everyone's saying, no, don't do it, and we don't want to do it. They're saying, hey, we want it spelled out how this is going to work if it happens.
Thank you for that. That will be coming, absolutely.
Thank you.
you have something, Harold?
I
And
have something. The question,
I appreciate very much what you said about the old feelings from the past decades and so thank you for that.
Old community.
Now, Harold,
now, how long have you been in office, Laura?
8 years.
Okay, can you tell me how many times that you as a commissioner approved PILT money going to the hospital?
Not off the top of my head, no.
It has been several though, hasn't it?
Mhm. Yep.
And haven't they gone back and got more bond referendum, more money from the taxpayers as well? A couple of different times?
Taxpayers approved a levy, they did.
2 different times, yeah, and those are both concurrently in place as well right now, is that correct?
This year, yes, I
Yeah,
believe so.
both of them are in effect right now. And how many times have you guys approved paying the notes for them to the State Bank of Townsend?
Yeah. The hospital is a cornerstone of our economy. Our economy is the lifeblood of this community. We have a report, Craig, I can get that for you too. We have a report that our per capita income went from 13th to 44th with the near failure of the hospital. We're back into the 20s now because the hospital is getting better, getting stronger, getting on more solid ground. That's a big deal to a community. And having good jobs, which equates to good pay for the employees, which equates to less crime, this is all a good thing for the community.
You need to walk
bet. I'm
across
gonna
the
fight
hall
for
and talk to
business
them about
any
less
day
crime.
of the week.
He's got 100 and some cases on the docket right now. If
Wouldn't
that's
we
less
like
crime,
to see that less? Yeah, we need to build a strong community, a strong economy, because the positive ripples are worth it.
you as a commissioner are responsible for lessening the managing the tax dollars in this county, as well as making sure that the dollars are spent wisely.
Thank
And I
you.
can't see it happening.
We have a difference of opinion.
It's
That's
not an
okay.
opinion.
All right.
I can show
Cheryl.
you facts.
Okay.
Those reports you're talking about, those were projections. not actual facts. The 2010 census said Broadwater County was 44th in per capita income. Montana Department of Commerce 2013 records stated Broadwater County was 34th. We are nowhere near 17th.
Not 17th, no, in the 20s is what I said. Yes, we are. Those are a
Those
lagging
were
indicator.
projections.
No, the way that Esri does it, it is actually based on the facts that they compile, and it is a one-year lagging indicator. So if we're on a projection going up, there is a lagging indicator, so the numbers are here. We could be here, depending on what the projections are. So that's where the projections come into it. So,
Can we,
yes.
so as far as the health department,
Mhm.
the girls left, there's nobody to work there. And so where are we actually at? Because you mentioned when the state was on the phone, some things are solidified. When you mentioned that they're gonna stay in the county health department building,
Mhm.
right? And what else do you feel is solidified?
We do have an RN coming in. We just don't know what day.
The one you have coming in, the one from A to Z,
Mhm.
but
Yep.
not the other one, not the dietitian.
No, we still
That's a
need to
different
get the
person.
contract and then bring it forward for a vote. So,
So the one from A to Z is just gonna come in and hopefully be able to give a few shots and fill in a little bit of stuff because they can't do WIC.
we don't know that yet. They may not be able to. It depends on when we get the other contract. So we don't know what that looks like yet. I have asked specifically for somebody who's WIC certified. I don't know that we'll find that. In lieu of that, we've asked for an RN with a strong nutrition background.
Mhm.
That may be something we can work with. We don't know that, so that's not a solid yet.
Right.
We're still waiting
Well,
to see
nobody
who
can
that
come to
person
you
is.
just WIC certified. I mean, they have to.
They could.
If they had been doing, if they're doing WIC currently, right now,
Right.
yeah, and they wanted to come over and help out here for a little bit, but they'd have to be, or permanently, however it works out for you. But-
Yeah.
So for at least the next month though, rest of January, anyway, there won't be able to be any WIC services here in the county,
We don't know that for sure, but probably not.
right?
That we have to wait to see who the person is, what their
And
transcript
so,
looks like.
with all of the discussions and all the meetings you went to and the models and everything that you looked at, I mean,
And all that information is available to any of you that want to see it.
right, what, I mean, are we gonna try to step forward here before too long and decide, is the hospital gonna manage, the health department? Are we gonna try to get somebody to replace the girls that were there, or, and run it independently? I mean, which one of those are we leaning towards? Do we have an idea?
We need to have some proposals in front of us, we need to run the numbers, we need to have reports, we need to put that in front of the public. So it is a process, and it's gonna be a step-by-step process we have to follow.
Right, but I mean, I know you gotta go through the hoops and everything, get the steps done and all that. But do we have a direction that we're really looking forward? I mean, I know that you seem to be pretty excited about the hospital part, maybe joining in, saving some money with the administrator. That way and everything. Do you see one way or the other? I mean, what are we gonna do now? Cause we're in a hell of a bind. So which way do we wanna, how are we gonna go step by step? You're gonna have a bunch more meetings and, I mean, cause there's not really a vote other than between you guys and then whatever you decide to do with the lane now. And figure out, cause that's a process too, cause now you're gonna have to get somebody else in with the lane so that it's not just the two of you back and forth, and so,
Now, we've got a big plate.
right, where do you
It's
think your
full.
next step is though, and how quick do you think you can get to it? Cause if you just hire someone, first step is you have to decide, are you gonna hire somebody?
Well, the first step is to get somebody in there, and that's where A to Z comes in. That's a
Right.
temporary,
But that doesn't fix the
person
WIC
coming
problem
in.
most likely, but
again.
it's possible, I'm not
right.
saying it's not, but most likely it won't.
Right,
And-
that could happen with the contract at the end of the
Isn't
month.
WIC going to have a contract out of Missoula though? Isn't that what you said?
That's the
That's a dietitian and she does a different,
She doesn't do WIC.
She helps with the WIC that we
she's
have
a
now,
WIC
but she's not able
dietitian,
to do it on
yeah,
her own.
and she gives, all she does is give information to the WIC coordinators as to help them keep up with what they need on more of a state.
So she's not an equal to the proposed gain here. is what I'm getting at.
She's not an equal to the proposed.
So even this only dietitian WIC person that's supposed to, mystery person that's not named, that's gonna come here and help with WIC, that's, the Missoula contract's not equal to that person.
Correct.
No, that person is who, if our new WIC person, new dietitian that they're trying to get comes in, they will work with that person in Missoula to make sure that everything works.
Okay, so that's not just someone we're outsourcing, that's someone that's being sourced to us.
Well, we have a contract with that person
Yeah,
through
we
the
pay
state.
for it.
Yeah.
Yeah, we're paying Missoula.
And they don't have anybody to consult, so to speak, now, right?
They don't have anybody to talk to.
Right,
now,
okay,
because the doors are
okay,
closed
so
and everything like that.
that's what I wanted to make sure, that's not, that person from Missoula is not the same person, or the same position as the person we're proposing to bring in.
No.
Right,
It's
okay.
two completely
Just a
different.
consult, okay.
Right.
My question
Dwayne
is,
Fulham is
I'm-
next.
sorry.
He's had his hand up for a while. No question? All right, Carol.
So, everything that the Department of Health has done in the past, that's just on hold right now?
Yeah, until we get a nurse in, which we're expecting a call this afternoon, so hopefully in the next day or two. I was hoping they could actually start on Monday with the holidays. I was a little aggressive, so.
Okay, so
Hopefully
then
today.
immunizations can continue.
Yep. And you can still go to the clinic if you want, but yeah, until we get a nurse in there, hopefully any day now we can get that started again. As well as blood pressure and all the other things that people rely on public health for. Dwayne, do you have a
Yeah.
question now?
Dwayne Hall, I would like to know if we can get a budget from the hospital like we've asked for and never have received, to where we can clear this matter up. You say it's doing better? I don't believe
Okay.
it.
And that's fine,
Many people don't believe it.
okay.
So-
We've had Jenny come, we'll ask her to come again. Yep, not a problem. And she'll give us a report and a budget and let us know what the issues are or what the positives are. So I think that's important for people to know. All right, any other questions? Going, Carol?
So the CEO of our hospital will take on this job without any additional wages?
At this point, Carol, again, we don't have any proposals, we don't have any contracts, we don't have any plans, we don't have any numbers. All we have done is ask questions and look at the models that are successful in other communities. That's it. The model in Carbon County is the administrator supervises public health and at no additional cost. It's just one of their additional duties put on them. It's a very attractive model financially. The work is still done by employees of public health and in a public health building. So, yeah, that's very attractive to me. It saves money, and that's important. So,
Is that just one county? One county out of 56?
no, it isn't. I'm more than happy to share the information again. I've got a full report that's been here in a public meeting many, many times. You're welcome to it. In fact, I'm gonna leave a copy in the clerk and recorder's office so anybody can come in and purchase a copy and
Be
fill
glad
it
to
out.
have that.
It's
Thank
only
you.
3
The
pages.
one catch that the hospital, we won't have to pay them from our county taxes, but the hospital would be entitled to take a portion of their grant money to cover administrative duties.
Yeah.
The grant money, yeah, it's 5%. And
Yeah.
any grant has,
There
most
is-
grants have administration.
And how
But
much
here's
is
the
that
thing
grant?
is the grants pay
We have
for
lots of
the,
different ones.
the grants pay for the employees to actually do the work.
Mhm.
So the MCH grant pays for the employee to do that work. The WIC grant pays for the employee to do the work. There's a little bit extra the county has to pay for. It's not 100%. Right now, yeah, if that went under the hospital, then that grant money would pay for those people to do the same work. Public would see absolutely no difference. The amount over the grant would probably be covered by the hospital, not the county. But again, the county is obligated to pay for public health, so we would probably pay the hospital a certain amount. At least that's the model that we've looked at for other counties. Again, the public sees no difference. Same employees, same building, same public health services. It's just we're saving money on administration,
Well,
supervision.
I totally agree. I mean, I think if obviously you're gonna save the wages of a supervisor, of health and a supervisor by just simply absorbing it into another person, and if that person's willing to do that without a pay increase, or at least a substantial pay increase, you know, that's not equal to the amount of what it would cost to have employees separate, then, you know, definitely looks beneficial. I think as long as the hospital's finances are transparent in this though, because of their county involvement, that should be a requirement before this, it's even looked at is the hospital going to, what gains does the hospital get out of this besides just helping its community, I guess, because in the end, the hospital is a business. It's not just a county facility that just sits there. It makes money or it doesn't make money. It can fail, it can succeed, and when it fails, everybody else has to pick it up. When it succeeds, nobody gets the benefits except for the person who owns it or whoever is paying back the bond that they have. So it's, so I think that's really what's in question, is whether or not the hospital is going to, as a business, gain from its involvement with the county, because there's lots of businesses that would love to attach themselves to the county and get grants and all kinds of stuff and would bend over backwards to do different things. So if, as long as the hospital is not just banking on this proposal, then honestly it sounds good for it to be able to absorb as much money as we could possibly give them. I mean, and not overwhelm them. So it's I just really think that the board should really work together here and discuss thoroughly, what the costs and the benefits are to the hospital, as well as the detriments to this, and what could go wrong with it, the pros and cons. If you guys as the board could, as the county commissioners could kind of regurgitate some pros and cons back to us, and not just talk concurrently as if we weren't other meetings we wouldn't understand this meeting. I think we'd have a little bit better understanding on both your sides of the pros and cons of this situation, and then everybody can say, okay, you're right, that's a gain, and you're right, that's a con. And right now everybody's just guessing about what the gains are going to be, guessing about what the cons are going to be. So if you guys could take the time, to weigh this out, it sounds like it's so important. It's making people quit. It's making people resign. It's dividing the community. As the county commissioners, it's your responsibility to hold the community together, and that's not happening right now. And I think that's why everybody's upset right now, because if the county commission fails, then it comes back to the public to re-elect, re-talk, and it takes just as much time for the public to elect these officials as it is for the officials to do their job. So it's not something that everybody wants to deal with. People want to deal with their own lives and their own jobs, not county government. County government should just be working. And so when there's a hiccup like this and you see the paper resignations and hearsay back and forth, this is what gets everybody riled up. If you guys were more transparent about exactly what was going on right now, I don't think anybody would, really be up in arms like they are right now. I'd really suggest that county commissioners work together and come to a more transparent deal of what's going on right now with the hospital, so we can all understand thoroughly what's going on, rather than just kind of little details here and there.
Thank you. And to meet that goal, I don't want to put either of you on the spot, but do either of you want to say anything? We have the director of nursing and the CEO of the hospital here.
I apologize for being late. After roughly about 40 years in this business, beginning to see a lot of change in how healthcare is going to be delivered in the future, good or bad. One of the things that it's clear that Medicare will begin paying us based on a value basis versus a volume basis, which is a good thing. Included in that volume is many quality measures of how you're caring for the patient. And it's forcing healthcare to take a look at a much broader care plan for the people in its service area. Part of that is obviously the public health, and part of it is the wellness, and part of it is the clinic capabilities. than the diagnostic services and the actual acute care and long-term care. So as we look into the future a little bit, it becomes critical that we're all working together in how to go forward in caring for the population base. About 6 to 8 to 12 months ago, we had a brief discussion with public health on what their future looked like. We thought, since this transition was going to become apparent, maybe now is a good time to stand back, take a look at what the future might look like and how we could develop that future. And so the Red Lodge Hospital, which is affiliated with Billings Clinic, but for a long time was fairly independent, had teamed up with their public health department through the county. And we thought, well, let's grab a few people and go on a field trip and see how they're doing it. No harm in that, period, end of story. Only can you learn from what others are doing. What we found is this: Carbon County ranks, of all the health statistics in measuring your health care outcomes, ranks 5th in the state. Broadwater ranks 35th or 30th, somewhere in that level. The population of Red Lodge is the same population as Townsend. In the bottom part of the county, they have 1,000 more people in that county than we do in the total. So they're about 7,500 total people. We're about 6,000. But the town and the immediate service area is pretty much similar. So we started asking. We had a lot of questions that we put together on the way over, and it was just, I have to tell you, it was exciting. It was exhilarating to see the two departments intertwined. Public health working with emergency nurses, the long-term care nurses, the acute care nurses, and the hospital staff anxious to talk to public health on ways that maybe some family members could be helped. It was just exciting, and if you ever have a chance to meet Roberta, is her name, right? The head of the health department. She looks older than she is because the energy she has is incredible. They have a grant to do tobacco cessation, and it's a full-time person. They also have grants that are working with the school system where they have full-time nursing personnel through the public health department working at the school. And it just, it was exciting to see it, and you know, it makes you stand back, take a look at how we could develop a really successful program here as well. And that's not to say it hasn't been successful in the past, but the statistics, and you know, we didn't go back and research how different they might be, but that's something we need to look at. Certainly speak for themselves. I just can't stress enough how I think the positive influence on Broadwater Health Center that public health would have on the center and the influence positively the center would have with public health. And I think it just needs to be looked at closer. We're willing to help. I've heard all kinds of things about 20% would just go to administration. The one thing that that the Red Lodge community warned is that it's very likely that being involved with the public health, that it would actually end up costing the facility. But the benefits of really focused more on public health and working hand in hand together as a team, the benefits were incredibly resilient. And they kept going back to the ranked 5th in the state in their health status. So, you know, not to say that we haven't had our hands full for the last 3 years, and still do, but we're sure willing to sit and explore how we could work this together. I think it would be a great benefit to all involved.
Thank you. Great.
Do you think that the hospital can handle the strain of the county on it? Do you personally think so? Do you think it's gonna, is it going to be okay?
Are you talking about public health?
Yeah. Is it?
I think it would be a huge benefit to the people of the community, and that we all ought to put our shoulder behind it and give it a 3-year trial. I don't know what that would hurt. One of the things that was pointed out at Red Lodge is the location of the public health office didn't change. They wanted it downtown. They wanted it separate from the hospital. They did look at physically separate of the hospital. They did look at combining mental health and public health together, and tobacco cessation and all those things, and that made sense to me. I mean, there's a few other places, I'm sure, in the state that we could take a look at to gather more information. I think it's one of those things, I guess the answer is you gotta make it work, because it's such a great benefit, I think, to everybody.
But it has failed before, though, hasn't it?
No.
The hospital has not failed before?
What? No. The hospital was closed by a survey, and and we've been struggling ever since. But we're almost full now in the nursing home, and there are a lot of changes in healthcare. I can't tell you today that we're going to be there forever, but it's been here longer than probably all of us combined in age. So it's come a long ways.
I think that just the question is whether the hospital, after it's been stress tested years ago and failed, basically, and now it's rebuilding itself. No doubtedly, and the people that were involved before were part of the problem. And, but now that the hospital has rebalanced itself, is it going to just throw it off balance to give it such another anchor onto it, or should it be 3 more years of keep the hospital?
I don't see it as an anchor. I see it as a real opportunity for us to work together and create a better health environment for everybody.
Harold, did you have a question?
I do. The question that I have is, I don't see where, the statement I have is, I don't see where Red Lodge and Townsend are apples and apples. I think they're apples and oranges because of the distance between that Red Lodge is between the nearest health facilities. The nearest health facilities for us, as far as I'm concerned, is in Helena. And I think that they need to take a poll in this county and determine how many people in this county actually get their services from the hospital as compared to going to Helena or to Bozeman.
That's fair.
Well, we
I
have
really
that
just-
poll, and about 50% in the county do get care elsewhere.
I would venture to say it's probably more than 50%. And I would guess down in Red Lodge, it's probably not quite the same because it's a lot further for them to have to go to in order to get any services. And as far as the health center, as far as the hospital taking control of the health department here, I just don't think it's a very good situation for them, because I think that financially, the hospital has not been on good footing for I don't know how many years. And it's just, how many times has the hospital come and asked for more PILT money? Too many times. How long do you have, how much longer do you have to keep coming to the taxpayers and asking for more and more bailouts? I'm sorry. RY Timber is not in good shape, but I don't see them in here. I don't see the lime plant coming down here and asking for money. Those, you guys are a private entity.
No, we're not. We're a nonprofit entity. They don't give their timber away. We have to treat anybody who comes through the front door.
And so
and
does
we-
Harold.
Harold, let him finish. You let him finish. Let him.
And we probably write off on an annual basis anywhere from $400,000 to $500,000 of charity care that we offer the citizens that come through the door. That's what we're there for, and we take all comers. It's not like any other business. In regards to the exodus and the closeness to communities, Red Lodge is about an hour away from Billings. They've got actually two major clinics in the town. St. Vincent's has a presence, and Billings Clinic has a presence. They have very similar services, and they also are involved with levies as well. You know, it's when you give away $400,000 or $500,000 a year in care, it has to be made up somewhere. And you know, you're exactly right. We've actually started 4 or 5 businesses in the last 3 years, and those businesses really are almost at capacity now. Over a 3-year startup. We said it was going to be the roughest year, a third year, and financially it has been. But I really think that we're beginning to turn the corner, and I'm optimistic that we're going to be able to give the best service possible to our citizens here. And I think being involved, you know, there was an analogy shared with me. We used to have 2 libraries in town, and there was a big concern about having county library move into the city library and how that would be worked, and it's worked great. It's one of those things that if you can get the energy behind it to support it, it's really going to be a positive. And obviously it's had an incredible effect on their ranking for health status in the state, number 5 status. But I think they've got a good model too. I don't think it has to be on the hospital campus. I think it's probably better it's not. And but that we work closely together in accountability processes.
Can the hospital look at partnering with St. Peter's or
The
one of the
hospital's
other
been
places?
looking at partnering for 3 years. Okay, we've had St. Pete's has shown no interest whatsoever. Billings Clinic has, Bozeman Deaconess, they were incredible in helping us fix our revenue cycle that was literally broken. And Then we've partnered with a small company called Monida, who is made up of 7 small hospitals, primarily to provide services that we couldn't provide on our own, like coding, like medical records help, some revenue cycle help, and also contracting with third-party providers. So we've had our antenna up to partner with our surrounding entities, and we were probably most interested in the Billings Clinic just because they've got about 11 hospitals, small hospitals, that they're staffed up for to support. Really, the only other hospital system in the state that's sort of geared up for that is Benefice in Great Falls, and we're actually going to discuss some things with them this week. But I think you're right on, because we're closest to Helena. Why wouldn't that work? And if for whatever reason they're going through another transition of leadership, and I just don't think they're in the game, nor are they staffed up to work with the smaller facilities, unlike Billings Clinic, Benefice, and possibly Bozeman Deacons.
I think they need to take a polo in the county and find out actually, do some phone calls and find out the number of people that actually use the facilities here.
We have done that. I don't
I've
know
never
if
been
you.
called.
Yeah, no.
And nobody, none of our
Let me
neighbors.
respond to you, please.
Sure, go ahead.
We through the Montana State University, are required to do a community survey every 3 years. And so about a year and a half ago, we completed that survey through the MSU, asking for the needs and tracking where the actual patient care was delivered, and so on and so forth. And there were top 10 needs that were assessed were chemical dependency was a major issue. The MRI imaging was an issue. Mental health was an issue. Access to public health was an issue. And we sent out in a county of 6,000 people, we had 800 specific that were mailed out, not phone call, because phone call is skewed nowadays with cell phone. And we know that we treat about 49 to 50% of the patients, and about 50% leave. About 10% of that would go to Bozeman, and the rest of it goes to Helena. And that may be why we don't get too much energy from our neighbors to the north, because they feel like they're getting a good share of the economic interest from us to them. And we actually found out that on our smoking cessation grant dollars, I don't know what the amounts are, but we get 2 hours a month for coverage for smoking cessation from Lewis and Clark. And whereas in Red Lodge, they have a person full-time in their community working it all the time. So, I mean, there's some things that I think we can take a harder look at and all work together in offering that public health service. It's an incredibly important service.